We are here to discuss the cephalometric landmarks for dental undergraduates. And the cephalometric landmarks can be basically divided into two broad categories, the hard tissue landmarks and the soft tissue landmarks. But the hard tissue landmarks are divided into the anatomic and the derived cephalometric landmarks. On the skull, I would be telling you about the anatomic landmarks, which actually represent the actual anatomic structures of the skull. They can be unilateral, which are present just at the center, or they can be bilateral, which can be present on both the sides of the skull. So we start with the unilateral landmarks of the maxilla. The first landmark is glabella. Glabella is the most prominent point on the forehead in the mid-sagittal plane. This is the mid-sagittal plane. This is the glabella, which is the most prominent point on the forehead in the mid-sagittal plane. Then the next point in the midline comes the nasion. Nasion is the most anterior point of the frontonasal outline in the midline. This is the frontonasal outline. This is the most prominent point. This is the nasion. Then we go down. This spinous process is the anterior nasal spine or ANS point. It is the tip of the anterior nasal spine of the maxilla in the midline. This is also called ANS. Then this deepest point, if you look at this curvature beneath the ANS to the end of the bony process, the deepest point is the point A. So this is the deepest point in the midline between the anterior nasal spine and the alveolar crest between the two central incisors. You cannot see the two central incisors here, but you can see the alveolar crest. So the deepest point between the ANS and the alveolar crest of two upper central incisors is point A. You will make use of these points quite a lot in the cephalometric analysis. So these are basically the unilateral landmarks. Other is posterior. This is the lowermost anterior point of the alveolar process of premaxilla in the midline between the two central incisors. If you look at the alveolar crest of the two central incisors, you will see the prominence like this, and the lowermost point here is the posterior. This will culminate with all the midline points of the maxilla. Now, if we just rotate the skull a bit and we look at the base of the skull, we can see this point. Can you see the spinous process? This is the PNS point or the posterior nasal spine. It is the intersection of a continuation of the anterior wall of the pterygopalatine fossa. So you can see this PNS and the ANS is here. This is the PNS point. Then the basion point. This is the basion point. It is the median point of the anterior margin of the foramen magnum. It is quite difficult to appreciate it in the lateral cephalogram, but still this is the basion point. We finish with the midline points of the maxilla. Now if we just take a profile view. In the profile view, we can appreciate the bilateral landmarks of the maxilla. This is the orbital point. In the frontal view also you can see this is the lowermost point on the inferior bony margin of the orbit. This is the inferior bony margin of the orbit. The lowermost point is the orbital point. You can appreciate in the frontal also and you can appreciate in the lateral also, the lowermost point. Then the porion point. This is the porion point. The highest bony point on the upper margin of external auditory meatus is the porion point. This Porion point is quite a bit used in the cephalometric analysis because it forms the Frankfurt horizontal plane from Porion to orbital. So these 2 points are very essential for the Frankfurt horizontal plane. Then one of the derived points are also the pterygomaxillary fissure, the lowermost point of the pterygomaxillary fissure, which is the PTM point. You can appreciate a teardrop shaped appearance here. The lowermost point is the PTM point, which is in line with the PNS here. So on the cephalometric, you will see it in line with the PNS. This is the lowermost point of the teardrop shaped pterygomaxillary fissure. So with this we come to an end of about the unilateral and the bilateral landmarks of the maxilla. Now we come to the mandible. So if we talk about the unilateral landmarks of the mandible, the first point that we see in the midline is the infradental point. The infradental point is the highest anterior point of the alveolar process of the mandible between two central incisors in the midline. If you see the alveolar crest here, the highest point between the central incisors is the infradental point. Then suddenly you see a curve here. In this curve, the deepest point that you can see is the point B. It is the deepest point in the midline between the alveolar crest of the mandible and the mental process. So, this is the mental process, this is the alveolar crest. If you see the deepest point here, that is point B. Then we come to the Pogonian point. I think you will be able to appreciate the Pogonian point more in the lateral view. So, I will just turn the mandible a little. So, here the most prominent point on the anterior surface of the mandible is the Pogonian. This is the bony chin in the midline. The most prominent part here is the Pogonian. Menton is the inferior midline point on the mandibular symphysis. Here, the lowermost point of the bony chin is the menton. Nathion is a point which is in between the Pogonian and the menton is nathion, GN point. This is the midline point. But if you look at the lateral points, this is the highest point of the condyle, which is called the condylion. This is the point gonium. This is at the angle of the mandible. It is the intersection of the lines tangent to the posterior border of the ascending ramus and the mandibular base. If you look at this, this is the mandibular base. If you draw two tangents here, one at the posterior border of the ramus, one at the base, wherever they will meet, you will find a point which is corresponding, which is gonium. This point is also very important for all the cephalometric analysis for BDS undergraduates. You use it in Downs analysis also. Then you have an articular point. For this, we need both the skull and the mandible. Just join the mandible here. If you look at this, for the articulate, it is the point of intersection of the posterior margin of the ascending ramus and the outer margin of the cranial base. Wherever they will intersect in the lateral cephalogram, you will see this point as the articulate point. So with this, we come to an end about all the cephalometric, unilateral and bilateral landmarks that are present, that can be appreciated on the skull, both for maxilla, cranium and mandible. While we are discussing the unilateral and bilateral hard tissue landmarks on the skull, for better explanation and understanding, I would be explaining the same unilateral landmarks of the maxilla on a slightly lateral view. Sometimes we cannot appreciate it that well on a frontal view, so I'll explain it on a lateral view also. So the first point is glabella. Glabella, as I said earlier, is the most prominent point on the forehead in the mid-sagittal plane. This is the mid-sagittal plane. This is the most prominent point on the forehead. If we talk about nasion, nasion is the most anterior point of the frontonasal outline in the midline. This is the frontonasal outline. The most prominent point of the frontonasal outline is the nasion. Then point ANS. ANS or anterior nasal spine. It is the tip of the anterior nasal spine of the maxilla in the midline. Then point A. If you look at the curve which is formed beneath the anterior nasal spine to the end of the alveolar crest, you can see a deep curve here. The deepest point of that curve, you can appreciate it more laterally. The deepest point of this curve is point A. The deepest point in the midline between the anterior nasal spine and the alveolar crest that houses the two central incisors is the point A. This is the alveolar crest, this is the anterior nasal spine. In between, the deepest point is point A. Then posterior. Posterior is basically the lowermost anterior point of alveolar process of premaxilla in the midline between the two central incisors. This is the lowermost anterior point here of the alveolar crest. This is the ENS, and the point in between the deepest point is point A. So now we've explained all the unilateral points again at a slightly lateral view for your better understanding. So we hope this would ease out the identification of the unilateral and bilateral landmarks on the lateral cephalogram.